In this episode of the Prehab audio experience, I had Dr. Catherine Logan, who's not only a sports medicine orthopedic surgeon and writer, but also a physical therapist, and she holds a Master's of Business Association. With her unique background, we wanted to talk a lot about what does healthcare look like now, what does she think healthcare is going to turn into in the next 10, 20, 30 years here in the United States, and also how her background as a physical therapist has influenced her practice as an orthopedic surgeon. This is an awesome one for anyone that's interested in healthcare and seeing where it's going. She has such a unique background and experiences that have shaped her career, and as well as the conversation we had today. If you guys like this one, please rate, review, and subscribe. We know you'll like it. Enjoy.
The Prehab audio experience will teach you how to take control of your health through knowledge by optimizing performance, promoting longevity, and keeping your movement system in tune. Welcome to your host, the Prehab guys.
All right, and joining me today, I have Dr. Catherine Logan, MD, MBA, MSPT, who is a sports medicine orthopedic surgeon and writer, as well as a former physical therapist and personal trainer who also happens to hold a Master's of Business Association. Based in Denver, Colorado, she's attending at the Rose Medical Center, where her clinic uniquely offers the Fit Lab, a dedicated exercise testing space using motion capture and force mats to better follow her patients' rehab progress. Dr. Logan is also the head league physician for the Premier Lacrosse League, or PLL, caring for our nation's most talented men's lacrosse professionals on the sideline, on and off the field. She also travels internationally and nationally as a member of the team physician pool for the U.S. ski and snowboard teams each year. I'm honored to have you on today, Dr. Logan. I think your background is super, super fascinating. I think a lot of our audience members will think so too. And I'd love to get an idea, or I'd love to have you maybe introduce yourself a little bit and tell us how your educational path, how you got to yourself today. I think you just have such a unique experience and background with, being a PT physician and having a lot of business acumen as well. So welcome to the show.
Thank you. That was a very nice intro. Thank you. No, I'm excited to be here, excited to talk to you. So I guess the easiest way to start is I didn't, kind of grow up wanting to be a physician. That wasn't even on my radar. My dad had his MBA, and a lot of our conversations at the dinner table would be like MBA focused, and kind of, he was always very into making sure I had a good understanding of like my own personal finances from by the time I was in elementary school. Just like he wanted me to be like financially independent and financially savvy. So I think that's kind of where that interest sort of started. It was just about, not feeling like you weren't knowledgeable about those life skills. And then when I was in high school, my older sister, she tore her ACL 3 years in a row. Oh, wow. So she did and it was all, same knee. She did, junior year of high school, senior year of high school, and then she was a college athlete and again tore her freshman year, and then she was kind of just done. So since she was my ride everywhere, I was in her PT sessions like all the time. So I just became fascinated by it. So when I went to college, I was sort of pretty set, I'm going to be a physical therapist. So that's where that started.
Got it. Wow, I think that's really cool how your dad, having a background also in business, but wants to make sure that his kids, your sister, maybe other siblings you have those life skills. It's so important. They don't teach that stuff in school, and I almost feel like they should, because we need that stuff. We all have money, as much, even if people that don't like to talk about money, you have to understand where your money is and where it's going, and just finances, to survive as a human being in this in the world.
Yeah.
So
yeah, he would do these really interesting things where he would assign, I played sports growing up, and he would say, all right, you get $1, per goal, or, whatever it was like an age appropriate amount of money. and then, after the week or the game or, whatever, we would go to the bank, and he would show me how to deposit it, show me how to run the ledger and all that sort of stuff. But then as I got older, he would sort of like, cause he wouldn't really let me touch that account. And then once I got older and there was, not a ton of money, but some more substantial money in there, he would say, okay, now we're going to buy some stocks, and this is how we're going to do it. And this is how we're going to pick them. And, it was really like, it was just sort of a slow education that started when I was probably in like second or third grade.
Mm-hmm.
And by the time I was in college, we were doing, kind of more advanced, personal investment type things. And so I think that, along with, he was always buying me, I don't know if you ever remember this lady, Susie Orman. Do you remember that? She was like a personal finance lady you used to see on television all the time. But she had these books that were they're more about people getting out of debt.
Okay.
But they really had like a lot of core values of like, why should you save? Why should you invest in this type of account? Why should you not take out of that account? Like when you should start doing your retirement investment. And they have all these tables that, once you kind of look at them and you realize if you start saving for your retirement when you're like 22 versus, 35, the amount is just like ridiculous. That it kind of, right. So yeah, it was just that sort of kind of always in the background that made me interested in it.
Have you heard of a guy named Ramit Sethi?
So who's that?
He wrote a book called I Will Teach You to Be Rich. We actually had him on the podcast. For anyone listening. It's episode 22. A big finance guy. I read his book probably about a year ago, and it's very okay. It sounds like a for people that maybe not have gotten that growing up. It's like here's a crash course in like not just finances, but just like how to think about money, like the emotional side of it, and like how to rationalize about money and debt or savings or retirement and things like that. And I just feel like it's so valuable for everyone. That knowledge. So that's awesome that your dad did that. My parents did something a little bit similar with me too. I worked for my dad has a private practice, so I quote unquote worked for him, helped him with like stamps and like stuff like that. So started a Roth IRA account for me, like when I was young, like very little money, but you know, with compound.
Yeah, but it adds up.
Fast. Yeah. So that's awesome. So that was your interest in, I guess, more finance and business. And then you said you never thought you would be, you never were interested in medicine or an orthopedic surgeon, but it sounds like you had a lot of experience with the rehab side, with your sister going through it. So said you wanted to pursue career path in rehab first and PT. Is that correct? Yeah.
So based on my experience watching my sister, I got really interested in PT. When I was an undergrad, I did exercise science, exercise physiology, and I loved that. I thought all that exercise testing was super fascinating. And there was like a moment where I kind of probably paused to think like, would I actually want to do a PhD in this versus go to PT school? But I, ended up going to physical therapy school in Virginia and did, at that time, it was a master's. So I got my master's, went out, and I ended up practicing for 7 years. Mostly, like my first year, I was doing more like inpatient trauma kind of, but then very quickly did like sports medicine for the remaining 6 years. While I was doing that, I loved it. Like my decision to change was more around years like 3 and 4 or 2, maybe 2 and 3. I was working alongside a group that I wasn't working for this group of surgeons, but we had sort of a shared space. And this was in Maryland. And we, so you interfaced with these orthopedic surgeons every day, and you had lunch with them, and, they might pull you in to look at a patient, or vice versa. If you were seeing one of their post-ops, you might say, hey, can you look at this wound or whatever it is. So there was sort of this like interface that I had with these surgeons all the time that I started to get more and more interested in what they were doing. And then, I would shadow them in the OR. And that was really when I started to think, I think like this could be a path for me. But at that point, you start to think, all right, like I've already got a graduate degree. I've already went down a path, and I wasn't unhappy. I was just starting to think about, what do I want for myself when I'm like 50 years old or 55 years old? Do I want to be a clinician, PT? Do I want to be a private practice owner? Or do I, and I was starting to contemplate all those things. And I still needed to do prereqs for medical school. So ultimately the way I kind of made the decision was like, I got like a ridiculous amount of cups of coffee with like lots of different professionals. And we're like, tell me about your job. Like, whether they were like a PhD physical therapist or a practice owner physical therapist or an orthopedic surgeon. And I think the main thing during that like year journey is I was trying to figure out, why don't you like your job? Instead of sort of asking what's so great about your job, I just really focused on why don't you like your job. And at the end of the day, I tried to figure out, for me, was the downside of that job a problem for me? And that's ultimately, you know, I think I was pretty thoughtful about actually making the leap, because going down the med school route, especially, you know, I kept working full time and was taking my prereqs at night and taking the MCAT course on the weekend. And you know what I mean? All of a sudden your life is just not as fun anymore.
Yeah.
So you have to make sure it's what you want to do. But for me, like, I had done the work to figure out it was the right decision, and, you know, I have no regrets at all.
I think that's fascinating, first of all, but I think it's really one part I picked out is that you not only talking to other professionals, which I think is so important to get an idea of what it's like day to day in the trenches and talking to people that you may know, but then asking about the negatives, because you already know, you're like, well, I already like healthcare. I already like to help people. I already know I like orthopedics or sports medicine. So you already know you're going to like the career path, and now just trying to find out, well, what is other parts of the career? I think that's super interesting, and I've never heard that before. That's awesome. That's really cool. It's really, really cool.
Well, because especially if you talk to physicians that are older, you know, they have a lot of bad stuff to say, you know, because it's really changed a lot over their time in that field. So they'll say, you know, especially with EMR or, you know, just reimbursement, you know, so you have to sort of sit down and be honest with yourself and know that it's not all glory and there's a real downside to it. And, you know, are you okay with that? And are you still going to be happy? Because you certainly don't want to make another pivot point in your career and realize like it's not what you thought it was going to be.
Correct. I tell that to a lot of the aides or volunteers.
Yeah.
I'm very happy you're aiding. First of all, there are a lot of people that just don't do that, and they volunteer to try to get an idea if this is a field they want to get into. And volunteering is already a great step, but I feel like you need to work there and feel like, okay, this is something I can see myself doing. Because if you invest all that time and money, that's a huge, like I had a couple people in my PT class that didn't, they, you know, dropped out for a variety of reasons. And I was like, well, that's a lot of time and money that went to nowhere. So. Yeah.
And it's hard to get in. So it's, you know, you've obviously worked really hard to get there. But I think, you know, we had a couple people drop out. We had a couple people drop out of med school. You know, it's a lot of money, a lot of your time, and a lot of, you know, lost time in figuring out what you really actually did want to do.
Yeah.
So I think instead of me sort of saying, wait, I'm not going to be going to med school till like I'm 30, I had to really be like, it's okay. Like, just make sure you're making the right decision first, you know?
So important.
Yeah.
Well, and then now you're done. We're primarily practicing as an orthopedic surgeon now. Is that correct?
Yeah.
Do you practice at all? Yeah. I was going to ask, like, do you practice at all as a PT, or is there anything that you, besides of course the experience and everything that shape you, do practice like formally as a therapist at all?
So it's interesting, like the way I have my clinic set up, it has, you know, it's not like I bill under, you know, a therapy code or anything like that. I still like maintain, you know, I still have a license, but I don't, you know, kind of actually use it. But in my clinic, you kind of indicated earlier in the intro, we have what we call the Fit Lab, and it's basically a lot of exercise testing and a lot of what you probably more likely see in a physical therapy clinic or an academic kind of physical therapy campus, as opposed to like an orthopedic surgeon's clinic. But that's sort of how I consider kind of blending the worlds. Whereas like today, you know, seeing post-op ACLs, for example, it's not like when they come in, I'm like, all right, let me just check your Lockman, and all right, your straight leg raise is fine. So like, okay, good job. See you later. Yeah. They spend like almost 40 minutes going through a bunch of testing where we hook them up to sensors. We have cameras, we have force mats. They do squats, lunges, jumps, single leg squats, you know, any sort of sport specific kind of thing. And it gives like a real deeper analysis for me to sort of say to like the physical therapist that I've paired them with, like, all right, you know, they're doing great here. Now this is what we've got to tackle, because, you know, instead of doing anything I think most surgeons look at things as like time dependent still, and like you're 6 months out, so you get to do this now, or you're 9 months out and you get to do this now. And, obviously, that's not the way to do it. So that's really how I incorporate the background. And we do the same thing with, I think a very typical kind of person who comes in my clinic is, the adolescent female who has anterior knee pain, who says she's already done physical therapy, but her MRI is totally clean and she still has pain. And, I think in her mind, she's strong and she doesn't really need to do the physical therapy, maybe didn't do her home program, or maybe didn't do that many sessions. Whereas if you kind of put them through the ringer and put them through a bunch of testing and show them how like weak they are or how inflexible they are, whatever the deficit is, you get much more buy-in, and then they'll return to physical therapy and be like, yeah, basically like I want to do better. And I kind of saw in that video analysis I'm not doing so sweet.
Yeah.
So I think that's kind of how I combo the background.
That's huge. And I almost feel like that's almost how it should be. There's a couple of the surgeons up here, they have motion testing labs, but they're all in part of big hospitals. So they luckily they have the ability to have these motion testing labs. And it's so much, I love the reports that I get from them, because they have these motion speeds. Like I'm looking at it with my eye, and I have a lot of other objective things that I use, but they are able to measure stuff that I can't measure. And again, the objective stuff is so huge for the patient. It's like, hey, no, look, you can see yourself. Here are the numbers. Like we still have to do these things, even though you're a certain amount of time out and the graph, quote unquote, is safe enough to do it, or your friend at that time frame was doing it. Your body is not able to do it. It's not your graph, it's your body, or your physical fitness, whatever it may be. And that's important to get patients and especially young athletes to understand.
Well, I think it's also helpful, when you're getting to that return to sport question, whereas, you have someone who's super anxious to return and they're like, no, I'm ready because I know somebody who returned at month, whatever. And then you're like, sure, you can return, but prove it. Like, show me that you can do all these things well. And then, if they can, great. But if they can't, then they know, all right, I got to get back to work. So it just helps, I think, with their commitment.
Yeah. And that's a great way of blending, I guess, your background in movement science and PT into your practice now as an orthopedic surgeon, which is awesome. Are there any other things like that I guess you've taken from your background as a physical therapist and your education or anything like that you utilize more now, or anything that you find really valuable that in your training or, experiences from before as to help you now as an orthopedic surgeon?
Yeah, there's a few things. Like, I think one is, it's much easier when you have the PT background to help people set their expectations appropriately. Like, I think when someone comes into a surgeon's office and they're getting, rotator cuff repair or, whatever it might be, and patients, like, they always want to know so much detail about what happens after. And I think oftentimes it'll be, a surgeon will say, oh, you're going to be in a sling for this many weeks. And then, that's sort of the end of the sort of conversation, or maybe there's another tidbit or two. But to really like be able to say, like, this is really hard and this is really long and this is kind of what it looks like. And at this point, you're going to feel like bummed out. And then this part, you're going to start to turn the corner. Like, it just, you have a really good visual of the whole process, as opposed to, those little time points. As a surgeon, like, we think of things as like, all right, this checkup is about looking at the wound. This checkup is about looking at, is there motion there yet? And this checkup, I'm looking at its strength. Like, and that's sort of how we're trained to think of certain evaluation time points. Whereas, like, having the PT background, you have the privilege of being like, no, I get the whole picture. I get that, like, this part, they're like super depressed. And this part, they're like, starting to feel more like themselves, but maybe their graft isn't totally integrated yet or healed. So I need to get them to like slow down a little bit, so I think it allows you to see the whole picture much better. So as much as it was a long road to do like both those careers, like, it absolutely has benefited me like so much more than had I done med school alone.
Yeah. It almost makes you, I always toy with this notion of college, the 4 years of undergrad. And I think it's a great learning time as a person. Like, I learned so much about myself and grew as an individual and maybe how I'm thinking, but it didn't do too much to me from a professional sense. So it's almost like, what if we went to school for 4 years and then, I still grew as a person, away from my parents, like living on your own, learning to do finances on my own. But then maybe like, oh, well, I went to school and I could finish and be a physical therapist then. And if I wanted to, I could start, I could go into my field or then take that knowledge and then, almost what you did and go somewhere else with it. And it would speed that timeline up for people and give people a more holistic view of maybe with the whole route that someone would go through, which is really interesting. Yeah,
it's hard because I think making those sort of decisions when you're like 18, 19, 20 is really hard. And, I, as much as I'm sort of, grateful for like my ultimate path, I think I wasn't, I certainly wasn't doing a lot of self-reflection when I also like when I went to college, I was 17. So, as far as like maturity level to do like self-reflection. And, I remember having one professor who told me, I think, she was the one sort of trying to push me to do the PhD in exercise science. And she had sort of said to me, like, I think you're going to find being, a pure clinician and PT limiting for you. I think, you should think about other things. And, at that point I was probably like 19 or 20. And I just thought like, what does she know? The maturity to like, or at least I didn't, I don't know.
No, I did not either.
Really reflect. So it's hard making those decisions early. It really is.
Yeah. No.
So, and I did tell her, I did circle back to her many years later and give her the chance to tell her, I told you so.
I told you so. I guess another question I think that came up in conversations with my partners. What are some of the things that you think, I guess, physical therapists knew or understood more about orthopedic surgeons? It doesn't have to be about orthopedic surgeons as like the person, but maybe the profession or how things work, how they think, and then vice versa. What are some things you wish orthopedic surgeons knew or understood better about the PT profession, kind of going both ways?
Yeah, I think, well, if starting about like what, PTs know about surgeons, I think, I think one of the hardest things is, and PTs experience it too, but is there's a huge crunch on, being productive and seeing patients, like a ton of patients, and, because there's a lot of overhead associated with running a surgical practice. Mm-hmm. And I think, sometimes people get a lot of slack for having quick appointments and not, answering questions well. And I think, certainly everybody could be better at it and everybody could take more time. But I also think there's a lot more pressure on physicians these days to document a ridiculous amount, as there is on PTs. But I think we're all feeling that crunch. Mm-hmm. So I think kind of knowing that, everybody's in that same place where they're trying to get as much done in every visit and trying to be of as high quality as they possibly can. But it's not like the old days of surgeons where, they're, free to do whatever they want. They get a lot more pushback from insurance companies, from their hospital systems. Their hospital systems might say, like, I want you to use, a screw from this company instead of that company. Yeah. They go through a lot of the similar fights that I think the therapists do. And then for, what I think the surgeons, what I wish they knew about the therapists is that, just like physicians, they have like subspecialties, and I don't think they really understand that. I think they think a physical therapist is a physical therapist is a physical therapist. So you can see a total joint and you can see an ACL and you can see a spine patient and all be, and they don't really think about, people develop areas of interest and, and areas of expertise, and it's changed over time, and that they should make some efforts to actually kind of get to know who's the best match for their patient. So, there's great therapists, in our community, and they have like different niches. So it's my job to sort of figure out like who's going to be really good at seeing, ACLs versus, who's going to see my partner's like spine fusions. It's not an all, one size fits all. And I don't think they take the time to do that.
Yeah. I mean, that's very true. The specialties are getting more and more big. The research is getting better and better. And while the rehab principles may be the same across, your rehab principles are the same, your communication skills are the same, you definitely develop specialties or per preferences, like you said, been based on experience. If you're seeing more of them, you're going to hopefully be better at treating them than if you don't see them.
Yeah.
So, yeah.
Well, I think there's certain clinics that are set up for, different types of patients, like, so we very much match make, and I'll know, all right, this patient is a little bit older and they're going to want like much more, kind of one-on-one time, maybe in a quieter kind of environment versus, some of the other places that have more of a performance kind of atmosphere. They have turf and they're going back to high level sports, and, kind of just understanding that just like any other medical profession, there's differences in the offices, and, you should go out into your community and learn about them.
Yeah. Like 100% agree. Going out in the community is huge, huge, huge. Getting to learn who you can not only, well, it's to help your patients. Like, who can you better refer people out to? Because I know something I've mentioned for me is I always used to think, oh, I can help everyone. And it's like, I'm getting much, much better at being like, no, I'm going to refer you here, or that's not my area of expertise. I'm sure I could help you, but this person could help you way more than I can. So knowing when to make those calls.
Yeah. And surgery is the same way. It's, you sort of start to realize like what part of your practice do you really want to develop over time, and what, part you're going to sort of push or share with a colleague because they've dedicated more time to that area and, they have more expertise, or, and ultimately it benefits everybody.
100%. With your unique background, we've spoken a lot about, your background in PT, background as a physician. And then we spoke a little bit about some of the similarities of how all fields across healthcare are being pushed to see more and more patients. And there's a lot of restrictions on all healthcare providers. I guess, what do you see as the future of, and this is a big question, the future of medicine and healthcare? Where do you see it going, maybe as a whole within your practice as an orthopedic surgeon, or what do you think we can expect in the next 10, 20 years for healthcare here in the United States?
Yeah, I think, and I'm sure you're seeing this as well, but what we're seeing in medicine with physicians is there's a lot more joining together. So even if you don't see this from the public level, so say if you're looking at private practices in orthopedics, and there might be, different, say there's like 5 different kind of orthopedic private practices in the metro area. What sometimes and often is happening behind the scenes is that there's actually a collaboration between those groups and a shared ownership of certain things that help them sort of negotiate insurance company contracts together, or, share overhead, or, share billing, things like that, even though from the outside they look like they're totally independent practices. And, and they are maybe in their day-to-day operations, but sometimes there is an umbrella over them that actually puts them into one like kind of super group. So it's interesting because I think the public might not even know sometimes that's happening, and it's not because it's not transparent. It just, it's kind of complex and hard to unravel, but that has almost become a necessity. So just because, real estate is still expensive, overhead is still expensive, getting, the things that you need for surgical equipment, or X-ray, MRI, whatever it is that your practice has invested into, all those things are expensive, and then the reimbursements are going down in certain procedures. So, but if you can, instead of being a group of, say, 10 surgeons, but you're like a super group of 80 surgeons, you can go to an insurance company and negotiate together and say, hey, we've kind of banded together and we're going to change our negotiation process so that now our strategies co-in together, so they'll end up with a better rate, which is hard because then some of these groups get bigger and bigger and bigger, and then the smaller practices that are, maybe a 1 or 2 man kind of group, they get pushed and pushed and they keep losing, and then maybe they go away, or maybe the hospital buys them, and so I think all those things are happening at a somewhat accelerated pace, where the little small niche kind of practices are going away and physicians are going into bigger groups. And, I think that's happening in physical therapy to an extent that, the one location physical therapy clinic is hard to persist.
Yeah, I'd say that's definitely happening in the PT realm. LA's been it hasn't happened as big in LA as other places when I travel, just because there's so many different practitioners, and I guess you can say niches that you can develop a practice in, but everywhere else there's big corporations buying out other corporations, buying out other small practices, all being branded the same. which again helps with negotiations. But I guess the one thing in PT that I've seen that I don't know if I've seen elsewhere is that while there's this big shift in the insurance practices grouping together, there's a lot of people doing what's known as like cash PT. So going completely, I don't even want to call it, I guess it's technically out of network, but some people don't even do out of network, which is pure cash. And starting niche practices. And there was a notion at first that you couldn't scale these practices, but there are definitely people doing it out there where they're scaling, very niche practices tailored to a certain, like, oh, we're going to treat active CrossFit athletes or bicyclists or things like that. And that's not happening in the orthopedic surgery realm, right? There's not people going like, oh, not going and taking any insurances, going cash.
Yeah, there's not a lot of it. It certainly exists, but it's pretty much like in Manhattan, or, it has to be, in obviously very wealthy kind of areas. Where you do see it more in medicine is with primary care, like the concierge practice.
Yes.
So there'll be, they set some sort of fee schedule and say, here's what you have to pay out of pocket to me per year. And this gives you, whatever the access they've sort of agreed upon, whether it's like 24/7 phone call or email access, whatever it might be. But like within my building, there's 2 concierge practices. There's one across the street. There's a lot in kind of major cities because the cost isn't so excessive. Obviously, if you're going to get, an ACL or a total joint or whatever, you're looking at like tens of thousands of dollars out of pocket. Whereas if it's a concierge practice, it might be $10,000. I mean, it really depends on where you are in the country. But, for a lot of people, if they have complex histories, or need a lot of kind of primary care visits, whether it's for lab work or they just have like multiple medications, it's worth it to them if they have the cash. But that's pretty much where you see it, is really in the primary care. Not that it doesn't exist, it's just not very common in orthopedics.
Do you think that's going to be a trend that continues to, I guess, expand, that primary care physicians may go to this model? I do know, I've heard of some online ones where it's primary care physicians, and it's like, I think it's like $100 a month. You talk to them like telehealth, and then send you out to labs and things like that, which I thought was pretty interesting.
So I think that'll continue to happen. And I think what will happen more so in orthopedics is people are going to start and this obviously happens in PT too, they're going to start refusing certain insurances. They'll say, we're going to continue to work with X, Y, and Z, but not, A or B, because the reimbursements are just, too low, or, sometimes the turnaround there's certain, it's interesting, like even when I'm ordering an MRI, there's certain insurance companies that'll approve it within the day or two. And then there's others that'll say they'll take like 15 days, and you're like, how is that even?
How is it even? Yeah. If it takes 6 hours, why is it taking so long?
Right. So they, I think they don't staff as much. They have less people reviewing the sort of charts, all that sort of stuff. And, if you're trying to, maintain a certain quality of care, and you want people to have their MRI, and they, because if it is surgical and they need to go faster, all those sort of delays, because then you're thinking, okay, what's the surgical auth process? Is that another 15 days? It can create a lot of problems, and also just like paper trail kind of management in your own practice. So I think over time, as people get busier, they say, you know what, I'm not going to deal with that company anymore because they just make it too hard.
Yeah, it's sad, but that's definitely how it is for PTs too. Like some insurance companies only approve 3 visits. You got to write a note every 3 visits, or they
torture you.
Try to torture you on purpose to get you to stop. And I feel like they do this more to our patients than even to us.
Right. Exactly.
Yeah. Oh, the bad guy. Are you involved in any like medical or health related business ventures right now? Clearly you do own your own, you operate and own your own practice, correct? The Fit Labs.
So that, and then the other stuff that it really comes into play is, so I started a nonprofit in 2009 when I was in medical school in Boston, where we basically bring in services to an underserved high school area, where it really started out as like, they had a good athletics program, but they had a hard time getting their physicals done, things like that, because, people were just in tough socioeconomic status brackets and, maybe didn't have parents who could, get out of work and bring them to the doctor to get their physicals. And back in 2009, this is kind of the process we started at the medical school, is to like bring the physicals to them. Mm-hmm. But then over the years, it's kind of grown where, now we do a lot of like career kind of assistance to help these kids in this high school get to the next step, whether it's like 4-year college or 2-year like trade college or not. And, started a scholarship program and, so that's really grown over the years. So that's something I always have kind of my eye on to make sure that we're developing and, utilizing, my skill set in that way. And then the other part where it really comes into play is, with the Premier Lacrosse League. That's a new league. So, you're kind of starting everything from scratch and, having a business skill set to look at things and be like, all right, what do we need? And what, how do we want to staff this? And what's going to be like our operational flow when we're on the road and, when we're setting up their preseason physicals and their post-exit physicals, like, there's a lot of management kind of stuff that is really on strategy and operations that I've leaned on my MBA a lot for.
That's cool. That's really cool. Is that very popular are there a lot of orthopedic surgeons that have the MD, MBA, I guess, dual credentialed, credentials is the wrong word, but I have both of them.
Yeah. I don't know the stat, like how many people in orthopedics get their MD, MBA. So in my med school was about 220-ish, and there was 11 of us that did it. Yeah. And there was 2 of us that were in orthopedics. So that's my small little study.
Let's take those percentages. Yeah.
But on a national level, I'm sorry, I don't know the stat.
Okay. Well, that's awesome that you're able to blend just your very unique background and not only clinically the things that you're doing, but also, outside of the clinic with your nonprofit and with PLL. And for those of you women listening to the podcast, we interviewed Mike Ginta, who is the physical therapist at the forefront of the PLL. It's episode 25. If people are interested in learning more about the PLL and kind of the medical management, Mike spoke a lot about how you guys work together and how you have a whole medical team and how you manage all of the athletes, especially because the league is set up in a much different way where all the players are part of the league and you kind of travel around. So that was really interesting to hear how you guys are managing them.
Yeah, I think if you have like, business interests, like it's just like a case study and like, all right, you're setting up this whole new thing. So you really have to think about every component for how are we going to, document, like which EMR do we want to select? What are we going to pack in our medical bags? There's just like an endless to-do list of things. And then, you're also in a new stadium every week. So, it's basically you have to like create like an emergency action plan every week. Like, all right, if something goes wrong, what hospital are we going to? And where, what ambulance company are we contracting with? Like, there's just a whole like myriad of things where for me, I find that totally fascinating and not overwhelming. Like, I think it's exciting. But, that's sort of the background of the MBA where you're like, you want to tackle these kind of problems.
That it's interesting you mentioned that. I was just in Canada. I forget what race was up there, some sort of skiing race, and it got delayed a day. And I was like, well, why did it delay a day? And it was because the weather, not at the mountain, but at the hospital that they were going to have to transport people if someone needed helicopter transport, that the weather was too bad. I was like, wow, I would not have even thought of that, but
there's always a million things.
Yeah, that goes into that management of that.
You have to, like, each time I got to a stadium, like, I would, on game days, I was like walking around, you're looking at where's my emergency exit, where's the ambulance sit, where's the defibrillator, where's, you know what I mean? Like, because you always have to be prepared. Like when I was a resident, in Boston, the Boston Marathon bombing occurred. And, all of a sudden our trauma service was totally huge influx of all these trauma victims, a lot of amputees, a lot of, and the hospital was completely prepared. I thought like they really shined and, it's a horrible experience, but it sort of taught me like, all these other things that you have to think about that you can't just pretend that might not happen, that you always like, you do those drills and those meetings and you come up with those algorithms for a good reason, so you'll pay attention and be prepared.
Preparation is huge.
Yeah.
I don't want to take up too much of your time, but we have two questions left for you that we ask every
Yeah,
guest
go ahead.
on the show.
Okay.
The first one is, what advice would you give to any of our audience listening right now, whether they may be a young clinician, a student, or just someone that's just really interested in medicine, or maybe they're in medicine? What advice would you give to them, from looking at where you are now to someone younger, maybe 20 years before you?
I would say, and I tell people this a lot, it goes back to what I said about like getting cups of coffee or meeting somebody for a drink. And, there's a lot to learn about the good and bad of any decision you're going to make, whether it's a career decision or buying a new house decision, whatever it might be. Don't be afraid to ask people who have more expertise or a different perspective on a problem than you. And I think back when I was doing that and trying to think if I wanted a different career, I cold called a lot of people or got their email, and not everybody gets back to you, but a lot of people do. And sometimes they're not getting back to you for good reason. They're just overwhelmed or busy at the time. But I was really kind of shocked by, people who I thought would never have the time of day for me. Would just be like, of course, yeah, like come to the hospital, let's go have a cup of coffee. And, and they would really spend a great deal of time. So I think whatever the decision is that you're sort of wrestling with, like, it just is so eye-opening to just ask other people what their thoughts are, and don't be afraid to ask them like what they're unhappy about and what they don't like about it.
I love that advice. Could not agree more. You have to ask. People say, oh, I don't have something. Well, if you don't ask for it, you're never going to have the opportunity to have that yes. You may get 50 no's, but all it takes is a yes for you to go on whatever it may be. So that's awesome advice. The second question I have for you, and the last one is, what does prehab mean to you?
Ooh, do you mean prehab for like for
anything.
you guys?
Could be anything. I guess when you hear that word, what does it mean? What does it mean to you?
So I guess it's sort of colored by like an earlier conversation I had today, where I had a woman who was in my office and she tore her ACL, and she said, she basically was like, I was told I have to, the earlier the better. You get your ACL done earlier, you have a better outcome. And, and this was a very, knowledgeable, not in the medical field, but like very smart, intellectual woman. And she didn't have good range of motion at all. So she lacked about like 15 degrees of extension, and she could get up to about like 80 of flexion. And so, we had this long talk about like how the outcomes are better if you go in, and I was sort of explaining this concept of like literal prehab for ACL to her. So like in the most literal sense. And she was just sort of like baffled by that. Like she had never heard of that. And then I think it was hard because she, had already been to another doctor who said, you have to do this week or you're not going to have a good outcome. So that's sort of what's coloring my mind right now. But that's like the most literal definition of like doing something before you're going to like engage in the full rehabilitation process, which for her was going to also include a surgery.
Yeah. And hopefully she buys into that, because it's going to be that much easier for her afterwards. That much better for her. Her recovery is going to be that much better.
Yeah. And I mean, it's easy because the data is so clear. You can just sort of print out some papers and say, look, I promise.
Yeah, I promise you. Yeah. You're going to thank me later.
Yeah, it's not just like clinical acumen. There's actually evidence.
Yeah. Thank you for your time, Dr. Logan. That was an awesome episode. Yeah, I got for our guest, if people want to reach out to you, where can they find you? Like on social media, website, things like that.
Yeah, so social on Instagram is cloganmd, and then website is also cloganmd.com. So all pretty simple. And then, as you know, we have my podcast, which is the Injury Report, which you can hook into from our website, cloganmd.com. And we also have a bunch of like rehab protocols up there. So hopefully that's helpful.
Awesome. Yeah, she has a great podcast. We spoke probably about a month or two ago about BFR on her podcast. I'm actually going to be flying out to your clinic in, I believe, March. We'll go March 21st, Saturday, 2020. to teach a BFR level 1 course with Smart Tools. So if there's any clinicians, trainers, trained coaches, anyone in the area, other orthopedic surgeons in the area that want to learn more about BFR, it's going to be March 21st in Denver. So,
perfect. It's going to be fun.
It'll be really fun. All right. Thank you, Dr. Logan, for your time.
Yeah, thank you so much.
Yeah,
you have a great day.
Holidays. Have a good day. Thank you guys for tuning in to this episode of the Prehab audio experience with Dr. Catherine Logan. I think her advice for any young aspiring student or young aspiring clinician or professional is just so valid. Get out there, ask around, even cold calling people, gaining experience and learning firsthand from other people is just so valuable to not only, maybe answer a question you may have about a career, but just to grow as an individual. And talking to others that have gone through it is just huge. For those of you guys that want to reach out to Dr. Catherine Logan, I've included her Instagram, her website, as well as her podcast, The Injury Report, all in the show notes below. If you guys like this, please rate, review, and subscribe. The reviews really do help us. If you have any other topics you'd like us to talk about or any other guests you'd like us to interview, please let us know as well by emailing us or DMing us online. Thanks again for listening.